When it comes to your health, I understand there are sensitive issues, but always make sure you go through it and explain to your healthcare provider such that things can be handled easily. We are going to be looking at types of vaginal discharge and what they actually mean, if they are dangerous in terms of color, in terms of their signs, in terms of their implications. The other day we made a video on what your vaginal discharge says about your health, but today we are going to look detailedly on the color, on the various symptoms of this vaginal discharge and what they actually mean. If you're a lady watching, please, it is important that you always report a change that you doubt to your doctor. If you are clicking on a video for the very first time, you're welcome. I'm your host, Tima Dauda, medical laboratory scientist at Tima Diagnostic Center and a reproductive health consultant. Thank you so much for joining as we discuss this together. Don't forget to hit that subscribe button, and you also share this video one or two friends. May God bless you. So we are going to look at the various types of vaginal discharge and their implications. The very first we are going to look at is Whitish cottage vaginal discharge. This is mostly associated to yeast infection. So if you have this cottage-like vaginal discharge, it is mostly associated to yeast infection. And yeast infection, here we are talking about fungi, which therefore means if you have it, the treatment should be anti-fungi. But make sure you talk with your doctor to know if this is actually what it is. Do not just go and you get anti-fungi straight away. This particular discharge is also associated with painful intercourse, swollen vulva. So it is good that if you have, please make sure you talk with your doctor such that this, if at all it is yeast infection, then it can be handled accordingly. Remember that yeast infection is naturally in the female vagina, but you may have an increase due to the change in the normal flora. The next we are going to look at, the next type of vaginal discharge we're going to look at in terms of the color is yellowish green. This should actually tell you that there is an issue with an STI. STI is sexually transmittable infection, and yellowish green vaginal discharge is not healthy because in itself is offensive. In itself, it contains burning sensation during urination. It also contains itching. It also comes with abdominal pain. So if you have this could be as a result of Trichomonas Vaginalis, and also as a result of gonorrhea. I know a lot of people have heard about gonorrhea, but I don't know how many persons have heard of Trichomonas Vaginalis before. Trichomonas Vaginal is a parasite in which when it infects you, you may have this yellowish greenish vaginal discharge, and it is linked to a lot of vaginal itch as well as painful penetration. If you have it, it therefore means you have trichomoniasis. Please put in the comment section below if you've ever heard of Trichomonas vaginalis or trichomoniasis. The next type of vaginal discharge we are looking at is red or pink vaginal discharge. Now this can be normal as well as it cannot be normal. If you have this, it is important that you also talk with your doctor, because how will you know that it's normal and how will you know it's not normal? Generally, if you have this around your period, definitely when you're about to expect your period, if you have this, then this could be normal, because this could signify that your period is about to come. Let me say you go to the bath and you want to clean up, you see, oh, you see this discharge look pink, it looks pink as well as maybe ready. This could tell you that your menstruation is about to start. It is also normal when you have intercourse. So if you have intercourse, you could also have this, and this could also be normal. But now there is an issue when you have it also. If you are pregnant, early pregnancy, this might mean that it is implantation bleeding. And it could also be dangerous because it could mean that it's a sign of miscarriage. So that is why it is important for you to talk with your doctor and know exactly which one is it. Do not assume and stay at home. It could also be endometrial cancer. Cancer of the endometrium. This is not good. So you should talk with your doctor when you might see this and you start like, oh, come on, could I be worried? Be sure to talk with your doctor and confirm exactly what it is. The next type of vaginal discharge we're looking at is gray vaginal discharge. If you see this one, this is also an infection. This means you might have BV. BV is bacterial vaginosis, and bacterial vaginosis comes as a result of the change in the pH, which is the acid nature of the vagina. Remember, the vagina is slightly acidic. Because it's slightly acidic, if you have an increase in the acid level, therefore means the pH will change. This pH, once it change, you have this increase in this bacterial vaginosis, and this has a fishy type of smell. This can be treated also with antibiotics, but please make sure you talk with your doctor. Make sure your doctor understands this, and for your doctor to confirm if you take whatsoever thing. Do not just go ahead and you start taking things here and there. The next we are going to look at, and which is our final, is the clear vaginal discharge. It is clear. This is actually the one that tells you that you are normal. Remember that vaginal discharge in general is normal, but the issue is what is the color, what is the intensity of the discharge, what is the odor. The color, the intensity, the odor, and how frequent you have it, all of these should give you a better understanding of your vaginal discharge and for you to know if there is an issue or not. So if you have this clear vaginal discharge, then it is fine. Understand that this has no issue at all. Now, it is good that you know how you can improve in order to avoid some of these infections mentioned, how you can improve your vaginal hygiene. So the very first thing you need to do is that you should avoid douching. Douching is the washing of your inner vagina using chemicals or other products. This is wrong. This should be stopped. Avoid using perfumes as well. The next thing is for you to keep your vagina safe is that you wash your vulva. That's the outer part of the vagina should be washed very well. If you must wash the inner part of the vagina with something, it should just be lukewarm water, which has no chemical exchange inside. The next thing you need to do in order to keep your vagina clean is that you should wipe yourself from front to back. If you go to the toilet when cleaning, clean from front to back. You clean from back to front, you might take some bacteria from the back and you bring it to your vagina. The next thing is that you should practice safe sex. Safe sex means use condoms. It does not mean you should avoid pregnancy. Condom will help you avoid pregnancy, but safe here is in terms of avoiding STIs. The next is you should wear cotton underwear. Cotton underwear is the best because it soaks the water. Remember, this area is always damp, wet, so soaking this extra water helps avoid overheat, such that even the fungi will not overgrow. We hope this will go a long way to help you out there. Please, if you consider this article helpful, consider this video helpful, please help share, and don't forget to subscribe to our channel. Thank you so much. May God bless you. Please stay safe.